Yes.
Hey Nishant, how's it going?
Hi, Sumir. Hi, everyone.
Good to see you. How are you?
Good to see you too.
Yeah, excellent. Looking forward to a really fun event. Nishant and Anurag will be good.
Yeah. Hi, Anurag.
Hi, Nishant. How are you doing?
I'm good. Thank you. Very nice to meet you.
Very nice to meet you as well.
Oh, it's great to have such a fantastic group, Nishant and Anurag. And Ani, thanks for organizing an amazing event. Thank you.
Thank you. Thank you for the leadership and getting us going on this. Thank you.
Pleasure.
Yeah,
Exciting.
Thank you, Sumir.
Hey, Nishant. How are you doing, Nishant?
I'm good. Just lots of things going on, but everything is good.
Okay, man. Well, congrats on our new CFO. I saw that email, and COO. It's wonderful.
Yeah. I think we are very. I'm very excited. We are still kind of trying to figure out the start date and things like that, but most likely it will be in July.
Tremendous. No, tremendous. It's great to see AIF take such positive steps. And I believe we're live now, Ani?
Yes, we can't, there's 4 other attendees.
Okay.
So I think we should get started.
Okay, terrific. Well, welcome everyone. It's a pleasure to have all of you here on behalf of the America-India Foundation and this very important topic of COVID and the COVID fundraise and some of the terrible challenges that are happening in India now. We have a short program today, about 30 minutes for all of you. We're going to keep it pretty tight. And I promise we'll leave room for Q&A in the end after that for any of you that would like to ask questions of this amazing panel we have today. Nishant, who's the CEO of the America-India Foundation and our leader, and Anurag, who's a professor at Stanford and is also has led some amazing efforts that he'll talk about later to combat COVID in India. So I'm looking forward to hearing more from Anurag about that. Anurag also is involved with the biodesign effort at Stanford and also for the Center for Innovation and Global Health at Stanford. So looking forward to that. I'd like to start by talking a little bit about why COVID in India is so important and it's such a huge crisis and why it's worth all of us stepping up in this moment. You know, I've been involved with India professionally now for 25 years, and I have never, ever in my 25 years, quarter century working in India, seen so much pain and crisis in the country. It's really devastating. Some of the statistics that I'll share with you that are really disturbing are India has now become the #1 country for new COVID cases in the world, unfortunately. Thousands of Indians are dying daily, every day as we speak. Many of them are dying without access to any kind of hospital beds, oxygen concentrators, or basic medical supplies. In our holy river, the Ganges, huge numbers of dead bodies are showing up as many lower-income people cannot afford or cannot get access to cremation facilities. Many cremation facilities in India are overwhelmed. Experts estimate today that over 1 million Indians have already died from COVID, primarily in this second wave. And unfortunately, many more will. Some of the estimates range from 2 to 4 million that I've seen by the time COVID settles down. It'll potentially be the largest number of deaths that India has seen since 1947 during partition. So it is an absolutely humanitarian crisis. To top it off, India is totally unprepared to handle it. Only 3% of the population has been double vaccinated. Only 10% of the population's gotten at least 1 shot. And it's going to take a long, long time before the vaccination happens. Nishant, our CEO, is going to talk about that later today. On a more personal level, it's truly tragic. I have family members who've passed away from COVID. I have friends who've passed away from COVID. I have colleagues at some of our portfolio companies that have passed away from COVID in the last 2 months. And it's really spared nobody. I know people in their 20s that have passed away, people in their 40s, older people. And it's just an incredibly hurtful and disastrous disease. And I've never felt a greater need to help India. And that's why my firm, WestBridge Capital, is making a $500,000 matching gift to support, to support these efforts to fight COVID in India. And I'm asking all of you to step up. And all of you have been tremendous. Already, I believe we've already received $150,000 in gifts, even before the Zoom calls already started, which is tremendous momentum. And our goal is to raise $1.5 million for COVID, kicking off with this call over the next 2 weeks. And I would encourage all of you to really reach into your hearts and step up and give for India today. There's never been a better time to give, and never a better organization than AIF to give it. With that, I'm going to invite Anurag, who has tremendous experience in this field, is a professor at Stanford, as I mentioned, to share why he chose AIF for his India leadership efforts on COVID. So Anurag, please take it away.
Thank you, Sumir. This is an honor to be able to address your donors, your supporters for this worthy cause. There's a coalition that I'm part of called India COVID SOS, which is led by several of the Stanford professors, but it includes faculty members and researchers and policy folks and engineers, scientists from around the world, 500 or so. When this coalition started building up about 4.5, 5 weeks back, one of the most important things that we wanted to figure out was which organizations do we work with most closely, because we are a coalition. We don't have a way to receive money and bring money to India to these needs that Nishant is going to talk about, I hope. And we did a pretty thorough analysis of all the organizations that were active in India, both US-based and India-based. Some amazing organizations. It's just been all hands on deck, and everybody has stepped up, from a small little NGO to very large NGOs, from government organizations to academic organizations, institutions like ours. And our criteria was very clear that this be a very credible organization, should have deep expertise in India, in the last mile, especially with the ASHA workers and with the ANMs and other health officials at the state level and the block level, the rural area level. And also the unmet need that India had in the phase 1, and as we get into the phase 2, which hopefully we'll talk about, has the deep expertise in sort of bringing technologies and other solutions, non-technological solutions to these communities. And AIF measured so well and so highly on each of these. We already knew about AIF's work beforehand at Stanford, but this due diligence actually helped us see substantial ways in which AIF was so far ahead, up above most of the others that were trying to figure out what to do in this crisis situation. It helped that AIF had been doing this work for a bit, that they were already prepared for it. So it was an easy choice for us to make ultimately. It's one of the very few anchor partners that we have as part of this coalition. And I think a number of our donors have already given to AIF as a result of that partnership. I'll say one more thing. I mean, at BioDesign, which is a center that I'm part of, and Center for Global Health, we've known of AIF's work before. And I think as we move to the next phase of COVID-19 response, I think it's very important that we all work together, especially led by organizations like AIF on the ground, to make sure that conditions that led to this crisis do not recur ever again. I think the problem that we see on the ground today has been in the making for decades. And I think the problem is big and it's substantive. And even though a lot of money has been raised, so far, a lot of oxygen supplies, oxygen concentrators have made their way, it's drop in the bucket as to what India needs. India needs tremendous amount of investment. And I know the government agencies are doing their part, but it does require civic society and NGO sector to contribute in ways that government just cannot meaningfully. So it's, I would encourage all your donors to really open your wallets and give generously, because we are not done with this challenge. And one last thing I would say is that what happens in India is not just India's problem. What happens in India is a global problem. We're already seeing the impact that we are seeing with the lack of vaccines that are being added to the COVAX facility that WHO and UNICEF and Gavi have. So that there is a direct impact there. There's also a direct impact from variants that actually emerge from uncontrolled spread of this virus. And we just have to be in this together. We have to do it together. Otherwise, ultimately, this is going to show up on our shores, and we will not have the excuse at that point. So it's time for us to step up and step up in a significant way. Thank you.
Anurag, thanks for that. And before I ask my first question to you, Anurag, I just want to take a moment and pause and just thank some of our generous donors. Firstly, Sunil Bhargava, thank you for your gift of $25,000. It's very generous. Thank you. Bob Peck, thank you for $10,000 gift. Phenomenal. Neeraj Gupta, thank you for $50,000. What a great way to start the fundraise. Thank you. And please, audience, please keep it coming. As Anurag was saying, India really needs your help today, and we really need you to step up. Anurag, one question I have for you is, you've taken a tremendous leadership role with a number of physicians in helping India through COVID. Can you comment on some of those efforts that you've taken and some of the impact that's had?
Yeah, I think one of the things that became very obvious fairly quickly, there are a number of areas where India was having a hard time coping with this crisis. Capacity of the beds, oxygen, essential medicines, just a range of things. But I think one of the things that became very obvious as the second wave progressed, and that would have long-term consequences for us, is availability of human capital. Clinicians who could really take care of these patients. They themselves were getting decimated. Their own families were infected. Many of them were actually taking the infection back home. Many of these clinicians on the ground in India were taking infection home, and their families were perishing. There's some really heartrending stories about kids going orphan as a result of that. And we knew that sooner or later, we will have a major crisis in terms of clinicians being able to address not only patients who are coming to critical care, but also patients who are being cared for at home or near home. And we needed to do that. We need to build that capacity. So, through an organization called API and Doctors for Seva, we basically, and Stanford clinicians, we engaged with, the patients and physicians in India, help add capacity on the ground. We obviously couldn't be there in person, but we offered our help in terms of advice and as a resource, and that's been some help. It's not the same thing as being there on the ground and being able to step in to fill that capacity, but we've been able to help a little bit.
Definitely, Anurag, thank you for that. That's really impressive and wonderful, the kind of support you've lent India in this time of need. I want to also thank Riyadh for his gift of $5,000. Thank you, Riyadh. And let me now turn to our fearless leader, Nishant, who's the CEO of AIF and has done a wonderful job in delivering amazing help to a lot of people in need during COVID too. Nishant, would love your commentary on what you're seeing happening on the ground with COVID wave 2 and the role that AIF is playing to really help with the crisis.
Thank you, Sumir. Thank you so much. And thank you, Ani and Riaz, for your leadership and for putting this event together. And thank you, Anurag, for your very strong endorsement and support. Really appreciate it. For some of the audience who may not be familiar with AIF, let me kind of spend 30 seconds on what AIF is. AIF was set up 20 years back in the aftermath of a big humanitarian crisis, a big earthquake in Western India. And since then, it has emerged as perhaps one of the largest, if not the largest, American philanthropic organization focused on India. We believe that our mission is to empower underprivileged women, children, and youth in India and to alleviate poverty in India. And we believe that poverty is multidimensional, and therefore we work on the three most basic, most essential, most immediate needs of poor people, which is health, education, and livelihoods. We are a secular and apolitical organization. We pilot innovative solutions and then work with the governments. When I say governments, I mean both the central government and the state governments and the private sector to scale up these solutions. But obviously our origins lie in a humanitarian crisis. So we have a very strong humanitarian mandate, and we have responded to all major humanitarian emergencies in India in the last 20 years. So COVID last year was no different. We launched a large scale program. We thought it was large scale last year, spread around across 18 states of India. We served more than 500,000 people directly and things like that, without realizing that the second wave is going to be so much more ferocious and deadlier than the first wave. So we were kind of smoothly, slowly transitioning to a more kind of medium to long-term recovery and rehabilitation kind of programming, when suddenly early March, mid-March, we started seeing a very strong and sudden uptick in the COVID numbers. And we again kind of huddled and tried to figure out what it means for AIF and our work. And so we launched our COVID relief in the third week of April. And within a few days, we realized that it's going to be a much bigger challenge. So we launched a fundraising campaign on April 24th. So it's been now 5 weeks since we launched our fundraising campaign. And I want to use this opportunity to thank all our donors who have shown tremendous confidence in AIF's ability to deploy these resources very quickly. We have raised around $30 million, of which we have already deployed $28 million in the last 5 weeks or so. And our focus has been, since the beginning of our response, has been on two things. One is, how do we strengthen the health infrastructure at the last mile? And within that, there are two pieces, and I think Anurag was talking about some of this stuff. One was oxygen security. So how do we make sure that patients and hospitals have access to oxygen? And that we have done by providing more than 5,000 oxygen concentrators, by providing more than 30,000 single-use disposable ventilators, which do not require electricity to run. So they are especially suitable for small cities and rural areas that have unreliable electricity supply. And we are now setting oxygen plants across 50 cities of India. So that's a very large scale response. And then the second part of our health infrastructure strengthening strategy was, as Anurag was saying, to increase the bed capacity at hospitals. So we are installing 2,600 beds across 35 cities of India. These are extensions of existing government hospitals, anywhere between 20 to 100 beds, which come equipped with ventilators and oxygen concentrators and other essential medical supplies and things like that. We have, from day one, we have prioritized working with the government hospitals across India. And that's because of our mandate. We know that poor people go to government hospitals when they need health care and health treatment. We also know that government hospitals are especially weak when it comes to health infrastructure and their ability to respond to such a sudden uptick in caseload that we have seen in the last few weeks in India. I think going forward, the second part of our strategy was vaccination. We know that vaccination is the only bet against COVID-19. And whilst we must celebrate the kind of near end of the pandemic here in the US, it is also very important to remember that the pandemic is not over until it is over in India. I think Anurag was also making that point. And within India, the pandemic is not over until it is over for the working classes, for the underprivileged, for the marginalized. And many of you are familiar with, most of you are familiar with the socioeconomic context in India. And that's why it is very, very important to make sure that we are prioritizing marginalized communities for vaccination. In a context where you have where India needs to vaccinate around 700 to 800 million people. And on the other hand, we have vaccine shortages. It's not very difficult to imagine that some of these marginalized communities will be excluded, at least in the initial phase. Eventually, everyone will get vaccinated, but you can do mental math right now. The target in India is 3 million doses per day. At this, and India is not meeting that target right now. India is kind of doing about 1.5 million doses per day. But even at 3 million doses per day, it will take almost 2 years for India to vaccinate all its adult population. We cannot wait that long, given what we have seen in the last few weeks. And so, what happens in a situation like this is that many of these communities get pushed to the end of this 2-year timeline, and we don't want that to happen. And we are talking about persons with disabilities, we are talking about tribal communities, we are talking about women in the unorganized sector, we are talking about daily wage workers, we are talking about street vendors. So these communities really across rural and urban India. And so in fact, today we launched our campaign called The First Million, which is about getting 1 million of these people vaccinated first. And what is, I think, more important than the million number is the message and the narrative that we want to set, where we basically trying to convey that India's vaccination drive is should not just be fast, but also fair. It has to be inclusive, equitable, and obviously transparent. And in setting that narrative and setting this messages, this message, First Million campaign will have impact on tens of millions of people across the country. So that really is our second phase of COVID relief. Sumir.
Thank you, Nishant, for that comprehensive assessment of the great work that AIF is doing on the ground in India for COVID relief. And I'm also really happy to see the level of focus on marginalized communities who are clearly the most impacted. I mean, many of them not only impacted by COVID, but also have lost all their income. So it's a particularly brutal time. So I'm really happy to see that focus. Nishant, before I ask you the first question on my side here, to kick off the group for any Q&A they may have, I'd like to just take a moment and acknowledge Rajiv Gupta. Rajiv Gupta, thank you very much for your very generous gift of $50,000. Fantastic. I'd also like to acknowledge Riaz Taplin, my co-chair of the America-India Foundation California Board, for his generous gift of $50,000. Riaz, thank you. And also acknowledge Robert Chatwani for his very generous gift of $10,000. Robert's a fellow board member also of the America-India Foundation California. So Robert, thank you for that. And it's great to see the generosity. I'd encourage the audience to please keep giving, either text Ani what you'd like to give, or feel free to just message in the chat. Also message in the chat any questions you have, or to Ani, and we'd be happy to take them. But I'd like to start with one question for you, Nishant, to kick it off a bit, which is to ask you, today, vaccination is a huge challenge in India, as you spoke about, as Anurag spoke about. But one of the challenges is availability of vaccines. Even if we can raise the money, can we vaccinate more people? How do we do it? And how sort of the vaccine shortage being addressed in India? And how can AIF play a role in that?
Thank you, Sumir. A very good question. As I said, we had vaccination as part of our strategy from day one. So we're talking about roughly about, third week of April. But we had put it on hold all this while, precisely because of the point that you made, which is about vaccine supply issues. Also, some of you may be aware that the government of India opened vaccination for everyone above the age of 18 years from May 1st. Of course, many state governments had to push that timeline by a few weeks because there was no vaccine. So there's no point in opening it up. So we wanted to kind of see how this whole vaccine supply pans out. It was not just that there was no vaccines available. We also did not have visibility on when it will become available. What we have seen in the last week or so, maybe 10 days, is that now that visibility has started emerging, now there are now estimates that by end of July, early August, India may have access to as many as 10 million vaccines per day, which frankly, in my opinion, is the rate at which India should be vaccinating its population. And so that is something that has emerged in the last week or so. As we know from our experience here in the US, vaccination is not just about, it's not simply about getting shot in someone's arm. A lot of education, awareness, nudging, mobilization needs to happen before you can vaccinate everyone. Look at the ads which we are still seeing in the US, encouraging people to go and get vaccinated, right? So in India, we're talking about a completely different context. Just a few days back, and not very far from the town where I was born, we had a very sad but kind of funny story where a vaccination camp was opened in the village, and the villagers ran away and jumped in a river so that they, the people who were trying to vaccinate them could not catch them. So we are talking about a Himalayan scale of vaccine hesitancy in some parts of India, and that has to be fought. And we have to start it now, so that we have a few months before we can get some of these people convinced about the benefits of vaccination and things like that. The other big part of the challenge in India is simply logistics. I mean, we all know that you have to register on an app to be able to get an appointment for vaccination in India. The phone penetration in India is very high as compared to many parts of the world, but it's still relatively low. And a lot of this penetration is feature phones, not smartphones. So people don't necessarily have access to apps. Even if they have access to apps, they don't necessarily know how to operate them. So a very simple process of facilitating appointment registration is something that millions and millions of people need in India. And you need an intermediary, unfortunately, to be able to make that process happen. And that is the kind of role that AIF wants to play, working with the state governments, working with the central government. We're talking to the Ministry of Urban Affairs, we're talking to the Ministry of Social Justice, we're talking to multiple state governments on facilitating this process of awareness building, mobilization, facilitation of registration, and pre and post vaccination counseling. And through that process, we want to make a difference to tens of millions of people through the First Million campaign.
Thank you, Nishant, for that explanation of vaccines and our vaccine strategy. Anurag, I'm curious. I have one question for you, and then we'll see if there are any other questions from the audience. If not, we will wrap up because we promised to keep this pretty short today, about 30 minutes. But Anurag, can you comment from your perspective on the vaccine program rollout in India and how it's likely to play out? As you were saying, it's not an India problem, it's a global problem, and vaccination in India affects the whole world. How do you see this playing out from your perspective, and any guidance to AIF as we think about helping India address it?
Yeah, thanks for that question, Sumir. And what a wonderful, detailed, and very insightful overview of the work that AIF is doing, Nishant. Really remarkable, and kudos for that. Kudos to your team. About vaccination, I think most people don't realize what a remarkable, and the word they use was Himalayan task, Nishant. It really is. It's actually vaccinating, 1.3 billion people in India. I mean, it's never been done. I mean, most vaccinations that you see in India are tens of millions because they are focused on newborns or below 5, or for certain kinds of diseases that affect part of the population. And so getting an entire country vaccinated in such a short period of time, where the consequences of not getting vaccinated are so high, it's never been done. It's never been done. And especially for a resource constrained country like India, this becomes even more difficult. Now, add on top of that the need to produce these many vaccines, where there are not that many vaccines available. There are really limited number of manufacturers, and the ones that can actually supply India vaccines at a reasonable cost are few. It just becomes and the rest of the world is also demanding those same vaccine shots. It becomes even more challenging, right? So, and then the layer on top of that, the problem that Nishant talked about in terms of vaccine hesitancy, that's a real problem. And if India does not get about 70-80% vaccination rates, it's not going to have what is called herd immunity, which is not clear that it's going to be there anyway, but sufficient immunity in the population that not a lot of people who shouldn't really be dying are dying. It's a preventable disease because of the vaccines. I think it's just a massive, massive problem. So my read on the situation is that it is going to take several weeks, potentially several months, before vaccine becomes adequate for India's needs and for the global needs. And it'll take next 6 months of really a lot of hard work on part of the organizations like AIF and the government and the last mile health workers to get it to all of the underserved communities, because they're the ones, that's where the vaccine hesitancy is probably the greatest because of the lack of sufficient education around vaccines. And I think that's, so I think it's going to be a really hard slog for next six months. And if we are successful, we will hopefully see 2022 where we would have within our sites a reasonable coverage of the population. But it's not a given. It's not a guaranteed situation. And I think we need a lot of work, a lot of investment, a lot of effort towards that goal.
Understood. Anurag, thank you for that. We have one question from the audience, and then we will wrap up here. And this really is open, Nishant, to you and to Anurag. It's a question from one of our board members, Riyadh, asking, are certain states in India doing better than others? And if so, why on COVID?
Nishant, do you want to take that first?
Let me, I don't know if I can give a convincing answer, but I'll try. So I think it is true that certain states are doing better than other states. Overall, the vaccination rate in India is still pretty low, about 4%. But in some states, obviously, it's higher than others. And there are a lot of factors. Demographics is one. Poverty levels and just simply awareness is a big factor. And it's not surprising, once again, to see that the poorer states are lagging behind in terms of vaccination. I mean, I just gave an example from a town which is close to where I was born. There are real myths and misconceptions. Menstruating women cannot take vaccine, diabetes people cannot take vaccine. If you take vaccine, you will, go infertile and things like that. And so there are all kinds of concerns. I mean, take a state like UP, for example. India's, average annual income is about $2,200. UP's average income is about $650. This is average, right? And so, we're talking about huge inequalities within India, and that unfortunately is reflected in the way vaccination drive is happening as well. And that's why we are focused on, in our vaccination work, not just urban areas, but also strongly rural areas and tribal areas, where obviously the vulnerabilities are very, very high. These areas also happen to be geographies where the public health infrastructure is at its weakest. So it's not just the risk, infection risk is very high, it's also the ability of the system to respond to COVID situation is also at its weakest. So at some of these things we will have to consider in our vaccination efforts. And as Anurag was saying, it's going to take months. See, the other challenge in COVID as compared to, some of you may remember polio campaign in India, very large scale campaign in India. But this time around, it's very different to anything that has happened in the past. We're talking about an infectious disease here. And so you cannot have, large scale awareness camps where you have thousands of people coming together and, learning about the benefits of vaccine and things like that. You will have to do door-to-door counseling. You will have to maintain social distancing and things like that. So it's going to be even tougher than some of the other vaccination campaigns that India has executed successfully in the past.
Good. Nishant, thank you for that. And there's a follow-up question here, which Nishant, maybe you or Anurag, both of you could take from Riaz, our co-chair in California, saying, is there a difference in states between those that have been run by BJP versus regional parties? Any differences in terms of vaccination?
We try not to get involved into, the party politics, but I think there has been some suggestion that BJP-ruled states have had better access to vaccines. Of course, until 1st of May, the exclusive right to procure vaccines was with the central government. Now, of course, the central government has opened it not just to states, but also to non-state actors, private sector, basically. And a lot of procurement is being done by private sector and by the states, not at the levels that we want, but still it has opened up. So I think there has been some suggestion that some states have had better access. But I think in terms of the vaccination rate itself, you don't necessarily see a distinction between BJP and non-BJP. You do see a distinction between richer states and poorer states. It doesn't matter who is running them.
Thank you, Nishant, for that. We have one last question, which we'll take. And I'll open this up again, Anurag, to you or Nishant. We have a question from Kushal Amin. And his question is, soon following the current health crisis, experts are projecting a growing education gap between kids from less privileged backgrounds and kids that have access to digital education. How is AIF planning ahead to address K-12 education livelihood needs over the next few years? Nishant, perhaps that's for you.
I think this is
anything you'd like to add?
I think this is a brilliant question. I'm so happy that people are thinking about it, because it's very natural and common for people to focus on here and now, to how do you deal with the current kind of immediate crisis, which obviously is a valid way to think about it. But what we learned last year is that COVID is obviously a health crisis, if you think of it. But the way the public policy responds to it and the way it manifests in terms of, lockdowns and, shutting down of schools and things like that, it has much larger, both in terms of scope, but also in terms of timelines, socioeconomic impact. So a health crisis leading to socioeconomic crisis. And it last year, it manifested in many, many ways. Of course, the most visible way it manifested last year, which I'm sure all of you must have seen, is the impact on migrant workers. But in less visible ways, it manifested itself in terms of the impact on learning deficit for children due to prolonged school closures. It manifested itself in terms of health issues for adolescent girls. We know from global experience, not just in India, but India is included, widespread deprivation leads to families marrying off their girls, their daughters at an early age. So we saw last year some of the gains that India has made in terms of delaying the age of marriage for girls. Some of those gains got reversed, unfortunately. And last year, in response to these things, and of course, large scale job losses and things like that, livelihood destruction. And we were all, as AIF, we were responding to these needs already. We had launched a program called Project Entrepreneur, which was about getting 1 million street vendors access to commercial finance through normal commercial banks and onboarding them on digital payment platforms and things like that. As part of that effort, we forged a partnership with the world's largest edtech firm called Byju's in India, which I'm sure many of you must have heard about, to provide K-12 educational content digitally to 10,000 government schools across India. That's a very large number, because as many kids in urban areas in India and of course here in the US could manage successfully to transition to digital platforms, millions and millions of kids in India do not or did not have that option. And I think it kind of, in a very stark way, exposed the digital divide that we have in India. That divide existed before COVID anyways, but it was not as visible. India has about 1 million state schools, public schools, in which about 220 million children go every day. And only 25% of these schools have computers. I'm not even talking about how well these computers are used. They don't even have computers. So the digital divide was already there. It was just so starkly exposed by COVID. And so some of these long-term impact, and we also know from global evidence, and this is an established fact, that any learning deficit at a young age in a child's life is irreversible. You cannot compensate for it later. So especially young children, who will be who have just started going to school or who are in grade 2 or 3, 4 or 5, they are unfortunately at the worst kind of receiving end of this crisis due to prolonged closure of schools. One more important thing, Sumir, I know I'm taking time, is the impact on nutrition. We know that millions and millions of children in India, especially remote, rural, tribal parts of India, rely, and their families rely on the midday meal that is provided in these schools for their nutrition. These children have not been going to school for almost more than a year now, and they have not had access to midday meals for more than a year. So the impact that it is going to have on their nutrition is something that we often don't hear about, but I think it is important to remember. So there are a number of ways in which this health crisis is going to have an impact on the socio-economic reality of India, especially the poorer parts of India and the more kind of rural, remote areas within India.
Thank you, Nishant. I'm really glad to hear that AIF's addressing the needs of COVID relief so holistically, and not just the health impact, but the whole socioeconomic impact, as you said. That's wonderful. I want to take a moment and just acknowledge a couple of very generous gifts. Netri, thank you for your $10,000 gift. Netri is one of our AIF California board members. Thank you, Netri. Peter Wendell, thank you for your generous $1,000 gift. Thank you, Peter. And thank you for a very generous gift to the Krishnan Shah Family Foundation of $50,000. And thank you, Anurag. In addition to all the amazing work you've already done, Anurag, thank you for a gift of $1,000. Thank you. I think that takes us, I'm trying to see here, I think that takes us, yes, to a total of $765,000. So a fantastic start to this 2-week process. I just want to thank everybody. That takes us beyond the 50% mark of a $1.5 million target. We will get to a $1.5 million target over the next 2 weeks. I know there's a lot of folks that wanted to give and couldn't make it today, but I've said they will be giving over next week. And I really want to encourage all of you donors. Firstly, thank you all. But second, encourage all of you to call your friends and spread the word that India really needs your help today. And please encourage them to step up. We'd be really grateful if you did that. I'd also like to take another moment here before we wrap up and really thank Nishant and Anurag for taking the time to speak with us today. I know Nishant, Anurag, I learned a lot, and it's wonderful to see the efforts you guys are doing, both of you, for COVID relief in India. Really fantastic. And lastly, I want to just thank Ani and the whole AIF team for putting together such a wonderful show, and the AIF California board for being incredibly supportive in making this event happen. So we're super excited. And again, Thank you, everyone. Nishant, Anurag, please, if there's some final words you'd like to say, please.
I just wanted to apologize to Anurag for taking away all the Q&A time.
No, those answers were spot on, Nishant. I mean, I couldn't have said those better. I'll just make one final comment, and that is global health. I mean, in all the years that I've been doing global health, one thing I realized is global health is not just about health. It's about everything together. It's about social status. It's about economic status. It's about water and air and nutrition. It's about education. Actually, there's a lot of research that shows that educational gap actually leads to health gap as well. So it's a really complex problem. Health is, and it has impact on the society overall, affects us all. And what's remarkable I've been observing AIF for a very long time, and what's remarkable about the way AIF approaches its work in India is in this sort of integrated and a comprehensive fashion. That's the only way you can solve this problem. So kudos to AIF.
And Sumir, I think my parting thought would be that this is something that I have. You spoke about your own personal loss. I have had the same. In my family, lost family members, and we lost AIF. As AIF family, we lost 3 of our young colleagues actually in the last few weeks. So it's been a very heartbreaking experience for pretty much everyone. I can't think of anyone who hasn't lost someone in their circles. But it's also been a feeling of helplessness that there's very little one could do about the challenges that people were facing. And I keep saying to my team and people who are associated with the AIF as donors, supporters, champions, ambassadors, is that we are so privileged and lucky that we have access to a platform like AIF to do something about it. Most people actually do not have access to such platforms. And that has what has kept the team going, fully energized and motivated to save as many lives as we can and to serve as many people as possible. So yes, all of us have access to AIF. AIF doesn't belong to anyone. It belongs to everyone. It's a collective philanthropic platform. So I will encourage everyone to get involved, to get engaged with the mission of AIF in COVID and beyond COVID. Really, thank you so much once again, Sumir, Riaz, Ani, for putting this event together. And thank you, Anurag, for your ongoing support.
Nishant, Anurag, thank you. And panel, and I just want to thank again the audience for your generosity. Thank you, guys. And please keep those gifts coming for AIF. India really needs it. Thank you. Take care, everyone. Have a great day. Great evening.
Bye.